Thank you for attending this webinar on how to respond to a records request. Just a quick disclaimer before we get going. The information in this program is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this program is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this program today. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. So for those of you that have no idea who I am, let me tell you a little bit about myself before we get started. Again, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years before I started my company, Target Coding. I am also a certified professional compliance officer and certified billing and coding specialist. That's what all those letters are after my name. My area of expertise is in coding, billing, cash practice compliance. Yes, cash practice compliance, documentation, risk management, record keeping, Medicare, and HIPAA. You know, I consider myself kind of unique. Let me tell you why. Most doctors are not certified coders, and most certified coders are not doctors. So you'll see during this program how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and I want to show you how to get paid for everything you do. Target Coding has been helping thousands of chiropractors and their staff members for over 15 years with our exceptional products and services. Now, Target Coding members, you could listen to this program again just in case you fall asleep or you don't have time to stick around for the entire program, or maybe you have a staff member that was not able to attend the live event. 24 hours after this webinar is over, Target Coding members, feel free to get the playback recording. You could also get all the PowerPoint slides that I'm going to be showing you, any forms that I'm going to be showing you. So Target Coding members, 24 hours after the program is over, just log into your account and you will see the playback recording, notes, and forms waiting for you. Also, Target Coding members, if you would like to download a certificate of attendance, there's a screenshot right on your screen of a certificate of attendance. We recommend you place your certificate of attendance in your billing and coding policy manual. Use the certificate of attendance as proof that you take billing and coding seriously, just in case you're pulled over by the coding police and you care about preventing fraud and abuse. By the way, just in case you lose track of the programs you take with us, don't worry. Our software keeps track of all the programs you take with us, all the CE courses, non-CE courses, on-demand courses, plus all the products and services you purchase from us. We keep track of it all. Any questions? Email info@targetcoding.com and one of our staff members will get back to you right away. Okay, let's begin the program. How to respond to a records request. Here's a question I have for you. Have you ever received a letter from an insurance company requesting patient records? It's not a fun experience. We've helped over 100 doctors over the past 15 years with records requests. It doesn't have to be that scary. It's not fun. It's not something you want to look forward to. You don't want anyone looking at your notes, right? You take notes on patients because you're required to. You don't want anyone looking at your notes. The most common people that will be looking at your notes if you get a request is an insurance company. But there are two other cases, actually three other instances where someone may want to see your patient records. If a malpractice case occurs, hopefully none of you are involved ever in a malpractice case, but if you are, you're going to have to give up your documentation and records. A state board complaint. We're working with 3 doctors right now that have had state board complaints filed against them by patients. You need to give up your records. And here's a simple one. Also could be pretty common. A patient asks for copies of their records. Mrs. Smith says, hey, I'm moving to Texas. I'm moving to another state. Or I want to get my records to my brother-in-law who's a chiropractor. So a patient may request records. Now we're going to be focusing on an insurance company asking for records. So let's say you get a letter from an insurance company requesting records on a patient. First thing is, I'm going to go down a checklist with you right now. Check the names of the patients listed in the letter that you received from the carrier. Are these your patients? Probably. However, I've seen some providers receive correspondence from insurance companies that were not intended for them to receive. Next thing you should do, assuming the patients that are in that letter are your patients, pull those charts, start to review them. Do the dates of service in your chart notes coincide with the dates of service that the letter is requesting? Do you have to send in all the records? You may have a patient that was in an automobile accident, then was put on maintenance care, then got health insurance. Now the health insurance company wants to see the records. Do you need to send in all the records from the PI case, from the maintenance cash services? The answer is no. Only the records related to what the letter is requesting. Now, let's assume the dates of service are correct, the patients are correct. Let's continue with my checklist. Now, are you required to submit the notes? You don't have to submit the notes if you don't want to, but that will cause some problems. First problem that may occur is that the insurance company won't pay you. If it's a prepayment audit, meaning you sent in claims and the insurance company said, well, we want to see the records before we decide whether or not to reimburse you, doctor. So that's a prepayment audit. Do you need to send in the records? Well, if you don't, then you won't get paid. Now, some of you may be saying, well, we're out of network. This was a cash patient. We're seeing a cash patient, and the insurance company is asking us for records. Do we have to submit the notes? You don't have to. You don't have any contractual obligation. However, the patient won't get reimbursed, and you may get put on a claim block. So, are you going to submit the records? You're probably going to. In general, it's not a good idea to ignore insurance companies that send you correspondence asking for records. I just got an email today from a doctor saying, we got a telephone call from an insurance company, left a message on our voicemail, wants records on a patient. I would not respond to that. Now, you can call the number back, but don't admit that it's your patient. Ask them to send you a formal written request, either by fax, email, or in the mail. Do not respond to telephone calls from insurance companies asking for records. Let's continue with our checklist. Now, in the letter, there may be a deadline. The insurance company might say, we are requesting to see the records within 30 days from the date of the letter. So after you look at the charts, ask yourself, will you be able to gather all the requested information by the request deadline? Typically, the carrier's going to request the charts to be submitted within 30 days. You might be going on vacation. I just got back from a 17-day vacation. I was in Italy, Greece, all over Europe. Great time. I didn't have time to respond to many emails. So if you get a request for records and you need to submit it by 30 days, are you going to be able to gather that information? It might not be reasonable. So call the carrier, request an additional 30 days to submit the requested information. It's okay to do that. You're not admitting guilt by requesting an extension. 99.9% of the time, the insurance company will allow you another 30 days. They understand you might not be able to get the records to them. 30 days might not be enough time. And also depends on how many records. If it's 1 or 2 patients, you should be able to get that in 30 days. I'm working with a client right now. 25 patient records were requested. 25 patients. That's a lot. That's actually not appropriate. And we negotiate everything. I mentioned that I've worked with over 100 offices that are involved with requests for records. Now, if it ever comes down to the point where the insurance company wants money, it's always negotiable. Every single case I've worked on, well, I can't say every, I would say 99 out of the 100 cases, the amount of money that was requested, we were able to negotiate the amount. Sometimes we were able to negotiate the amount down to 10%. The average is about 30% of what they want. So 30 days might not be enough time to meet with your billing team. You may need to meet with your staff members to gather the records. You may have had an associate chiropractor that saw some of these patients that the insurance company wants to see, and that associate chiropractor doesn't work for you anymore. 30 days may not be enough time. Next, should you contact the investigator? If you make this call, you may have the opportunity to speak to the lead investigator. I don't see any negative to contacting the investigator. Now, make sure you don't provide any information to the investigator that can hurt you. Now, I know some attorneys, they might not recommend you speak to the investigator at all. I don't see any downside to speaking to the investigator and asking for an extension. I don't see anything wrong with you asking them why you were chosen for the chart review. That's the first thing that we hear from doctors that are involved in a records request. Why me? Why do they need the records? I don't think there's anything wrong with asking the investigator why you were chosen for the chart review. Now, some of them are very good at being friendly and offering information. Some are very tight-lipped and they don't give you any information. Many of the clients we've worked with, they don't feel comfortable speaking to the investigator, so we speak on their behalf and we do the negotiating on behalf of the doctor. Again, do not volunteer any information that could link you to any wrongdoing. Now, the question is, should I get an attorney? Some chiropractors obtain the services of an attorney as soon as they receive any type of record request from an insurance company. Again, I don't see any downside to doing this. Now, if you speak to an attorney, the insurance company doesn't know that you're just speaking to an attorney. Now, if the attorney is going to take your case, now the attorney will be negotiating directly with the insurance company, and you won't be involved with any direct communication. That's what most attorneys do. And we've worked with many attorneys across the country. Some attorneys, most attorneys are good at negotiating with the insurance companies. However, we've worked with some attorneys that are not familiar with this type of work. I was working with one chiropractor that was being requested for records and a lot of money back, and he got an attorney who was a real estate attorney. So no, you want to work with an attorney that has experience with post-payment reviews and records requests. So I don't see any downside to speaking to an attorney. It will probably go under attorney-client privilege. When I get involved and part of the team negotiating with the insurance companies, I am also put under attorney-client privilege. So the insurance companies cannot get any information from me. So again, I don't see any downside to speaking with an attorney about your situation just to get a little feedback as to what the game plan should be. Let's continue with the checklist. Now, a treatment summary. That's not a treatment plan. I'm referring to a treatment summary right now. So after copying all of the requested information, I typically recommend providing the carrier with a treatment summary for every patient. This is a summary of the care you provided. It helps the carrier understand your clinical approach. However, some treatment summaries are not required. That's another question I ask the client that contacts me that's been requested to send in records. Some of the offices that we work with say, Dr. Kotler, my notes are really good. I have no problem submitting my notes to the insurance company. So if you think your notes are good, and could prevent a request for money back, just make copies of the records and send them in. Most of the time, the doctors don't feel that confident. So that's where I recommend putting together a treatment summary. So if you think your SOAP notes and treatment plans are sufficient, you don't have to put together a treatment summary. A treatment summary is a overall explanation of what's going on. So for example, if you're looking at your notes and you don't think they're great, and you didn't put down, let's say you billed for a time-based code, like therapeutic exercises, CPT code 97110. In order to build that code for at least one unit, you have to do it for 8 minutes. And you didn't put down the amount of time. And now you're about to submit the records. In your treatment summary, you could state the amount of time that you typically spend with those patients. It goes a long way to put together a treatment summary. However, they can be time consuming. Now, many insurance companies post their position statements. This is another question I typically ask the doctor, especially after they've been asked. Just yesterday, got a letter from a client that got a letter from Blue Cross Blue Shield. This client is being asked back for $187,000. $187,000. Ouch, that's a lot of money. So typically, when a doctor is being requested to submit money back due to a post-payment audit, I will ask the doctor, do you know what the insurance company's policy is on billing, coding, and documentation? 80% of the time, the doctor says, I didn't even know one existed. Most insurance companies post their chiropractic position statements on their websites. Please make sure to read these position statements from all the carriers you bill. Make sure to learn as much as possible about establishing medical necessity, E&M coding, and CPT ICD-9 code linking and setting goals for patients. In general, insurance companies want to see a beginning, a middle, and an end. The most important thing to do is stay calm. Just because you receive a records request from an insurance company doesn't mean you did anything wrong. After you submit the requested information, no news is good news. About 20% of the time, you may never hear from them again. So I was referring to these position statements. Here's an example. This is one from Aetna you should see on your screen. It goes over the chiropractic billing, coding, and documentation requirements. If you see Aetna patients, I would strongly recommend you read this document. Here's what, if you see patients, if you practice in Illinois, this is Blue Cross Blue Shield of Illinois' chiropractic policy on billing, coding, and documentation. I'm working with a doctor in Louisiana. She's being asked for her records. This chiropractor does dry needling. Well, if you're familiar with dry needling, 99% of the time, the insurance companies want you to submit codes 20560 and 20561 for dry needling. Well, that's not the case with Blue Cross Blue Shield of Louisiana. They don't want you to bill those codes. It says it right in their policy. For dry needling to be submitted, you're supposed to use 97140. What? What's that, Dr. Kotler? That's manual therapy, 97140. It's in writing right at the bottom of the slide. It says the claims should be submitted for dry needling using 97140. By the way, I think this is the only insurance company I've ever seen that required to bill 97140 for dry needling. They also want you to use the CG and 59 modifiers. By the way, you may be wondering, where do I learn all this information? I am constantly reading guidelines. When I do my live seminars, typically on the breaks, a lot of doctors and staff members will ask me, how do you become certified in coding? How do you learn all this information? I am a sponge for learning. I'm always reading the guidelines on E&M coding. That's evaluation and management services, your new patient codes and re-exam codes, CPT guidelines, diagnosis code guidelines, HCPCS guidelines, HIPAA guidelines, Medicare policy manual, always referring to that. I don't find billing and coding boring. I love what I do. I know most of you would rather have root canal than read the Medicare claims processing manual. I don't mind it. I like it. I enjoy what I do. You could probably tell from the passion in my voice. I just had to read a document in the Medicare Managed Care Manual. Those of you who are Medicare patients that come in with Advantage plans, talking about Medicare Part C, C is in cat, that's not traditional Medicare Part B. Medicare Part C are managed care programs. They're Medicare Advantage plans or replacement plans. Even if you're not contracted, you have to abide by the fee schedule. Unfortunately, that's the case. I'm always reading the updates from Aetna, Cigna, American Specialty Health, ASH, Optum, United Healthcare. This is how I stay up to date. This is how I learn all this stuff. I want to know what's going on. Now, this is the Medicare policies on chiropractic. They put out local coverage articles and local coverage determinations. So I'm constantly reading these. I recommend you do too. I also reach out to chiropractic state boards. Laser, shockwave, decompression. Some states do not allow chiropractors to treat patients for shockwave. So I contact state boards throughout the country. I keep my clients anonymous, constantly asking state boards for their position statements on many things. I contact the chiropractic licensing boards, the National Board of Chiropractic Examiners. I get newsletters and journals from the malpractice insurance companies. I want to know what's going on. I want to learn all this stuff. Not only do we teach billing and coding seminars and webinars, but we teach risk management, medical errors, malpractice prevention seminars and webinars. So I'm always looking at the malpractice carrier vignettes on chiropractors that have been sued for malpractice. I also get emails sent to me directly from the OIG, Office Inspector General. Here's a medical doctor convicted of insurance fraud, nurse practitioner, chiropractor going to jail for 30 months for defrauding the NBA Players Health and Welfare Benefit Fund. You may be wondering, why do I read all this stuff? I want to know. Look at this, a podiatrist convicted of a $4 million foot bath fraud scheme. What did he do? Why do I read this? A couple of reasons. I want to read this so I know how to prevent these problems from occurring. And what do? We put this information in a newsletter. Hopefully you get Target Coding's e-newsletter. It's one of the top billing and coding newsletters in the industry. We send it out about once per month, and we put these horror stories in the newsletter so you could avoid these problems from occurring. Here's a medical billing company. The owner of a medical billing company was just sentenced for healthcare fraud. Here's a chiropractor going to jail for 7 years. It's so sad. Convicted of insurance fraud. Okay, so one of the most important things to do if you get a letter from an insurance company requesting records is that your notes better prove that the care was medically necessary. And some chiropractors get confused. They go, well, Dr. Kotler, I do full spine adjusting. So I bill patients, even though they don't have pain in their neck. If I find a subluxation in the neck, I'll bill the insurance company. Big mistake. Don't do that. The patient must have difficulty with activities of daily living, restricted motion, and pain in an area in order for an insurance company to reimburse you. Any questions on that, email info@targetcoding.com. So make sure you know the difference between wellness care, maintenance care, and medical necessity. Medical necessity is insurance payable. What's medical necessity? I'll keep it simple. I'm not going to get into too much detail because we go over this in detail with our other webinars. Mrs. Jones comes in with the restriction in activities of daily living, decreased range of motion and pain. This is considered insurance payable by insurance companies because they consider it medically necessary. What's maintenance care? It depends who you ask. If you ask Medicare, well, if you ask CMS, It's a treatment that's required to identify an illness or an injury. It's consistent with the patient's symptoms and diagnosis. It's appropriate under the standards of care. It's not solely for the convenience of the patient or the doctor. It's the most appropriate service or treatment which can be safely provided to the patient in the most economical manner. We have a lot of doctors that are billing for back braces, getting paid $1,500 for a back brace. If you can provide the patient with a back brace that's only $500, you better do it. Now, I mentioned for the convenience of the patient or the doctor. What does that mean? Working with the doctor right now. Saw a patient 180 visits. I'm reviewing the notes. The notes say, patient would like to come in 5 times next week. So the doctor said, okay. Patient would like to come in 3 times next week. So the doctor said, okay. Doctor said, okay, because the insurance was paying for every visit. That's not the way it works. It's not up to the patient. Now, if the patient wants to come in and the care is not medically necessary, terrific. Just have the patient sign a form that they understand it's not payable, and you could treat a patient forever. It's another question we get at our help desk. Dr. Kotler, what should we recommend? Is it okay to recommend 3 times a week for a month? Is it okay to recommend 24 visits, 36 visits? My recommendation for you is recommend whatever you think the patient needs. It's okay to recommend lifetime care to patients. That doesn't mean that you're going to be billing the patient's insurance company for the rest of their life. That doesn't mean the patient's even going to come in for the rest of their life, but you could recommend what you think is necessary. Now, just make sure you delineate the phases of care, which we're going to get into in a minute. But first, I want to share with you what I think, what Target Coding thinks the 3 phases of compliant documentation are. The first phase is the treatment plan, which consists of the history, exam, diagnosis, goals. You're going to list the services rendered and the schedule of care. Would you like a sample treatment plan? Send an email to info@targetcoding.com. The treatment plan is like the foundation. Look at that house in the bottom right corner. It doesn't have a good foundation. I look at the treatment plan as the foundation of a house. After phase 1, the treatment plan, phase 2 are the SOAP notes, and your SOAP notes are just going to follow whatever you described in your treatment plan. And phase 3 is the reevaluation. That's your opportunity to remeasure your abnormal findings, update your CPT codes, update your diagnosis codes, update the schedule of care. You must do that upon every re-exam, especially if you're billing insurance. Now, phases of care. I don't understand why doctors put the phase of care in the treatment plan. It's not necessary. However, if you want to do it, go ahead, but make sure you understand these phases of care. And there's so many of them: acute care, subacute care, therapeutic care, corrective care, relief care, initial intensive care, active treatment. And then there's wellness, maintenance, routine, restorative, rehabilitative, palliative, supportive. It's not necessary to put the phase of care in your notes. If you want to, as I mentioned, you can. It's not necessary. Just make sure you understand that there's only 2 phases. You see all these phases? What are there? 3, 6, 8. I have, what, about 15 phases of care on the screen. There's only 2: active therapeutic care and wellness maintenance care. After every man, woman, and child gets a treatment in your office, doctor, you have to make a decision. Was it active therapeutic care, meaning the patient had restricted motion, spasm, pain, inability to perform normal activities of daily living? That's covered by insurance. Whether it's a cash patient or an insurance patient, that's covered by insurance because it's considered medically necessary. Now, when a patient has very little pain or no pain, could perform all their activities of daily living, that's wellness care. Maintenance care is different. I don't consider wellness and maintenance the same thing. Maintenance care is when the patient has plateaued and they've reached maximum therapeutic improvement. Either way, it's not covered by most insurance companies because they don't consider it medically necessary. So you have to pick one of these phases. Otherwise, you're going to have a problem. Don't get caught in the middle is what I say. Don't get caught in the middle. That's where doctors end up giving a lot of money back. Now, you're probably going to respond. Once an insurance company sends you a letter requesting records, you'll send them the notes. I'd say about 70% of the time, you're going to get a letter back asking for money to be refunded. This is going to require you to fight back. You're going to negotiate. You're going to send them a response letter. And I could help you do that. I've done it with over 100 doctors, and I'm very successful at negotiating these situations. What you want to put in your negotiation response letter is that your intent is to provide optimal care tailored to each patient's specific needs. You have a zero tolerance for inappropriate billing and coding. Unfortunately, you may need to admit that your documentation needs improvement. It's okay to do that. And you should tell them that you've already incorporated a billing and coding compliance manual. That's one of the best ways to get them to reduce the amount of money that they ask for. It's also the best way to prevent whistleblower action, putting together a billing and coding policy manual. We could help you do that if you would like. Now, here's a sample SOAP note. I call this the perfect SOAP note. This note would prevent an audit from any insurance company you bill: Aetna, Cigna, United Healthcare, Blue Cross Blue Shield, State Farm, Geico, Allstate, Medicare Advantage plans, Medicare Part B. It's the perfect SOAP note. It comes with a 10-point checklist. If you would like to get a copy, it's a little bit hard to see. I don't know if you want to take a screenshot. I don't know if you could see it. Those of you that are non-members, if you want to get a copy of Target Coding's perfect SOAP note with a 10-point checklist, send an email to info@targetcoding.com. Target Coding members, you already have this, or you do have access to this in your account when you log in. Just a few closing comments, and then we'll take a break. Prevention is the key. Don't wait for the oil light to flash on your dashboard to take action. Have billing and coding policies and procedures. Have a policy on billing and coding for your staff. We're working with an office right now, has 300 employees. Yes, you just heard me correctly. This is our largest practice, 300 employees. We're putting together a policy manual on how these employees get trained on billing and coding, just in case the coding police come knocking on your door. You should have that. You should have a policy on cash plans, on discounts, on prepays. You should have a policy on how you prevent the Stark Law and anti-kickback statutes. You should have a policy on co-pays, deductibles, and coinsurance. Here's a question for all of you. Is it okay to waive co-pays, coinsurance, and deductibles? You're all saying no. Trick question. There are instances where it is totally legal and okay to waive co-pays, coinsurance, and deductibles. Target Coding members, you know what they are. You should be doing background checks on any person that has anything to do with billing and coding in your office. You should be doing background checks on them. You have questions on that, send an email to info@targetcoding.com. And of course, you should have a policy on documentation. Besides medical necessity, when do you document? You should be documenting the encounter within 24 hours of the patient visit. Otherwise, if you send in your notes, you may get a letter back like this. Doctor, we want to see your notes. Cigna said, we don't like your notes. We want $250,000 back. Here's another one. I have so many of these. You probably don't want to go through all of these with me. I'm just showing you a few. These are the horror stories I'm referring to. Now, this one was good news and bad news. This doctor was asked to send in notes. The insurance company said, the good news is we're not going to ask you for money back. The bad news is we're putting you on a prepayment audit. And they give the reasons why. That's how I know what the insurance companies are looking for. I don't guess and gamble what the insurance companies are looking for. They give the information right in their response letters as to what they're looking for. So it's like the answers to the test. In this case, it says no plan of care was provided. The treatment did not change the plan of care. Some patients' treatments indicated the same treatment without improvement, which would indicate a chronic problem. That's not okay. Now, we worked with a doctor, very busy practice. She sees about 80 patients a day. She had to send in her notes, and she gets this letter back. This is good news. It says, "Dear doctor, based on the information reviewed, we found that all services were reasonable and necessary." And then it says, "We applaud you on your billing accuracy, and we encourage you to continue your current billing practices." Wait, what? It says, "We applaud you on your billing accuracy." Do you see it in this letter? I love this letter. So if you want to put together a billing and coding policy manual, I recommend you start putting it together on your own. If you have the time and the wherewithal, put it together on your own. If you don't have the time, but you have the money, contact Target Coding. It doesn't cost that much, and it doesn't take that long, and it'll definitely help you SWAN. You ever hear that acronym, SWAN, S-W-A-N? It means sleep well at night. You want to sleep well. Target Coding members sleep very well at night. Here's a book that I recommend. This book should be part of every chiropractic library. It's called The Guidebook on the Best Codes to Improve Reimbursement. It has 3 chapters. Chapter 1 gives you the codes that pay for the most visits, like sciatica. You get cheat sheets emailed to you with the hierarchy of the long-term treatments, short-term treatments, moderate-term treatments. This book also shows you how to pair you should be pairing your codes just like pairing food and wine. Here's an example. Myofascial release 97140 pairs with myofascial pain syndrome, M7912. Mechanical traction 97012 pairs beautifully with back pain and radiculopathy. By the way, your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing. So we show you how to pair your codes, and it's put together by anatomic site. Easy to read. You get a whole bunch of FAQs. This book will help prevent insurance denials. It will reduce administrative burden. You get the best PI cheat sheets in the industry. Staff members love it. Doctors typically take a page out of this book and they use it for the topic of the day when they do their staff trainings. We do webinars, we do seminars. We have on-demand webinars. We have a whole library of on-demand webinars on 25 different topics: risk management, Medicare, ICD-10, cash-based services like neuropathy, shockwave, laser decompression. We offer a CA training program. It's called our CATS program, Chiropractic Assistant Training Series. 6 one-hour classes. Great for new CAs. Even seasoned CAs have been benefiting from these. Class number 1, we go over spinal anatomy, chiropractic terminology, new patient onboarding. In class number 2, we show your CAs how to fill out a 1500 form. The 1500 form has 33 boxes. We go over every single box in detail. Class number 3, we go over how to complete prior authorization forms and the Medicare ABN forms. Class number 4, we go over showing CAs how to help the doctor do the SOAP notes. Yes, the SOAP notes. Class number 5, we go over ICD-10 coding, rehab procedures, modalities, unit reporting. And in class number 6, we go over HIPAA and the 7 elements of a billing and coding compliance plan. We also sell forms, logs, templates, fight back letters, cell phone use policy for staff members, consent to treat minor, financial hardship forms. All of our ABN forms are in this packet. Letters of medical necessity. You get them emailed to you instantly in Microsoft Word. All you need to do is copy and paste them right into your software. We offer memberships, 4 levels. Level 1, $99 a month, pay as you go. Level 2 is $199. Level 3 is $499. Level 4 is $599. Now, level 4 are for integrated practices. I would say about 25 of the doctors that work with us have brought in nurse practitioners to do injections, trigger point injections, knee injections using hyaluronic acid, viscosupplementation, PRP injections. That's our level 4 membership. We write HIPAA compliance manuals. We do chart reviews. About a third of my work week is spent doing chart reviews. We do credentialing. We do seminars in boring places like on cruise ships. We have our 3rd annual seminar at sea. Yes, I get a conference room on a cruise ship. We're using, oh yes, we're going on the Royal Caribbean Symphony of the Seas. It's coming up. I think it's sold out. There may be a few cabins left. We're going to St. Martin, St. Thomas, the Bahamas. 6 CEUs approved in over 35 states. We have a program on how to become a concierge chiropractor. We have tons of testimonials across the country. We have options to fit every practice: insurance practice, cash practice, in-network, out-of-network, Medicare, PI. Please check with all the carriers you bill prior to submitting claims based on this information. We can't guarantee this information will guarantee payment from any insurance company or patient. We're not responsible for any laws or rules that may change following this program. And you know, they change all the time. So it's important to do your best to stay on top of these changes by attending seminars, attend webinars, join your national and state professional associations. And again, prevention is the key. Feel free to follow us on Facebook, Instagram, LinkedIn, YouTube. I have over 100 free videos on YouTube. Here's my contact information: email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Yes, we still have doctors that would like to fax us information. So we have a HIPAA secure fax number. It's 1-844-831-2347. If you'd like to set up a free practice analysis, it's no charge. Normally we charge $350 for a practice analysis. Scan that QR code right on the bottom right corner of your screen. You could also give us a call or send us an email to set up a free practice analysis, or send us an email if you have any questions. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.